Thamizharasan here from Chennai Emcee's Entertainers and Professionals. How can you support others during the pandemic times? Whenever there is a pandemic, whether it's an earthquake or whether it's something medical emergency or whatever the flood or whatever the emergency, the same topic I used to speak so that people can make use of it and they can support others, because sometimes we don't know where to start. Especially the youngsters, they are ready to support others, but they don't know where to start, how to help others, because every day we are hearing a lot of news about the corona, the COVID situation. Some news are good, some are genuine, some are fake, and so many things, and people get confused with all those things, even though they have the heart, the willingness, desire to support others, but they don't know how to start it. So I'm going to give you basic tips what I've been doing, maybe right or maybe wrong. If you find it logic and if you find it you can apply it, yes, you can go ahead and apply it. So basically there are two ways you can support a cause. One is you can get directly into the field, another one you can support indirectly. When I say indirectly, let me come to it a little later. When I say directly, you can just get into the field. For example, like I've seen few people who are getting who are giving the support as a driver. For example, there is a theatre artist and an actor, Karthik TMK, one of the eminent personalities in the theatre industry. He used to take a lot of pregnant women to the hospitals when we had the COVID first wave. I saw him recently, and yesterday I saw an article about someone named Arjun Reddy or someone. I'm not sure about the exact I'm not sure about the name. Someone from the actor from the Karnataka who turned to be an ambulance driver who was supporting others to make them reach the hospital on time. Likewise, they have been getting onto the field. These are the examples I'm giving. A lot of the people are there who are getting into the field, getting the medicines for people, helping them, getting transported, all those things. So you can get into the field directly and support people. And second way, if you are a person who don't want to come out, or who doesn't have an opportunity to come out, at the same time you want to do something for the society, you can just forward the message, but not all the messages. That is very, very important. Not just like that, getting a message and forwarding to all the groups, which is absolute waste of time. You need to filter it. You need to verify some of the messages. For example, you get a message saying like these are the places that's giving COVID support. Then what you need to do, sitting at home, you can make a call to those numbers and you can verify that, and then you can share it with your contacts. You can say verified by personally by me, and you can mention your name. So likewise, you can spend some little bit of time verifying all those things so that you don't spam others, because we get a lot of messages, we get a lot of outdated messages, we get a lot of fake messages. So let's not waste others' time. So if you are going to sit at home and doing all this coordination, you can do the verification and then share it with them. In case you don't have time, at least you can tell some of your friends who are completely into this. That's what sometimes I do when I'm completely occupied with my work. At the same time, when I get some useful message, I just send to one or two of my friends who are actually into this, and I ask them to verify that, and they verify and tell me, and immediately I share it with the contacts whoever sent me, and also I share it with my other contacts. And you can forward some of the useful messages like related to treatment. Like I used to share one of the important messages from Dr. Veerababu, who is a Siddha doctor who has been doing a phenomenal job since last year. In fact, a lot of my family members and a lot of my friends, they got treatment from him, and they had a wonderful treatment with a great ambience, with a natural ambience, and they got cured and they came back. So I'm very, very happy with Siddha treatment, what he has done, and he has saved more than 3,000 lives in the COVID-1. And also in COVID-2, he is trying to do a lot more things, and has given a lot of interview like how he is treating. And he has given confidence that COVID-2 is pretty easy for him, because he is able to get a lot of medicine this time. Last time there was an unexpected lockdown where he was not able to procure medicine from a lot of villages because he used a lot of herbs. This time he is well prepared and he is able to get a lot of herbs, and he is well prepared to treat people. And he also got quite a bit experience in treating corona patients. So he is one person whom I have been recommending strongly. So I've been sharing a lot of updates about him in my WhatsApp status and also in my social media, and also I've shared it personally to a lot of other my friends. So this way we can share some valuable information to others, and whatever the information you get, you can verify that and you can pass it on to others. Or if you're clueless where to start, just associate with your people, with your friends who have been doing this. Ask them what is the support you can do. For example, some of my friends, especially Nandini and Anjali, Rupa, and a lot more, they have been coordinating a lot on this. They'll be asking me like one or two support. They have been doing it throughout the day, but one or two emergency cases, they'll ask me if I have any contacts in so and so place. So what I do, all I do is just put it in my status update, or I ping some of my friends who are in that particular region so that I can connect with them. So likewise, whatever the way it's possible for you, whether you want to get into the field, if you have time and if you have the art to get in, I really respect those people. To be honest, in most of the cases, I have never got on field, except very, very rare cases. In the last 5-6 years, I can say I've never got into the field, but I respect all those who get into the field, because that is very, very dangerous and risky one. They are taking their life under risk and they are helping others. I really bow my head for them. At the same time, even if you're not getting on the field, still you need not feel bad. You can sit at home, you can support, like how I said, you can spread good messages. Don't share all the things and don't make people panic. more than sharing the panic messages, share something useful. Don't keep sharing like so many people died, so many people got corona. Instead of that, share some of the good treatment method. At the same time, you don't become a doctor. Don't keep sharing all those things which is not verified. Share something verified, and share something where you can connect people to different hospitals, different places where you can get oxygen cylinder, or at least you can connect them to the volunteers. That will be the great help. Like, you know what, the volunteers who have been doing good job in your circle, connect with them, just get their number and ask your friends whom need the help and connect them. That will be of great help. So basically, I would like to conclude this video with once again summing up all those things. One, you can get into the field directly, or you can share some quality messages, verify the messages by yourself, share the messages, connect people, connect the volunteers with where there is a need, and whatever the good information you get, you verify and also you share it with your volunteers, so that that acts as an additional resource for them. Likewise, I did for a lot of my friends. When I got some messages, I verified it, and that has got added to the database of the volunteers who have been into it. So this is what I wanted to share. And apart from all these things, one important tips: you be safe. That is the biggest help you can do to the society and also to the doctors and the police. Because I have also been sharing a lot of memes like the police, the government, and the doctors. There may be a lot of criticism on the government. I'm not coming to that, but still, yes, everyone is doing their part to a certain level. Of course, to the doctors and the police, I would 100% I would say, like, they are dedicating their lives for this. So let's respect them. They are trying their best to save us, but we are not supporting them. For example, I'm in the event industry. I have decided that I will not go out for the safety of mine and also for the safety of the others for the next couple of months. But the doctors cannot say that, but the police cannot say that. Rather, they are not saying that. They are coming, they are risking their life and doing their job. So which, it's not only the job, they are taking it as a moral responsibility. They are serving the society. So the biggest help what we can do is, we have to take care of ourselves. Whenever we take care of ourselves, their work becomes less and it will be easy for them to focus on others. So be careful, like, try avoiding going outside. If there is any emergency, please go out, or else take care of your health. If you have corona, don't spread it to others. If you don't have corona, please don't go out and get it spread for yourself and your family. This is the biggest help you can do to the nation. Thank you so much. If anything, you can contact me on my WhatsApp 900 308 7198, alternate number 86102 57395. Thank you. Have a great time.